A client who has just undergone abdominal surgery calls the nurse and states, I feel as if I just split open. The nurse checks abdominal incision and finds wound evisceration. The nurse immediately contacts the physician, documents the findings, notifies the operating room, or takes the client's vital signs. So, those are our options. So, the question is asking us, what do we do now, right? What's our right now action? It's saying immediately. And so we know that's a priority term. And so our thoughts have to be, which one of these answer options do I have to do right now in order to avoid the worst potential outcome here for my patient? So it's telling us the client just underwent abdominal surgery and feels as if they split open, and we check and we find wound evisceration. So, thinking about outcomes, looking for our solution here, we know that means that that wound has in fact split open and the underlying organs are protruding through. And that's a medical emergency and a surgical emergency. So, we need to address that issue right now. We need to fix the problem right now. So, how can we do that? Thinking about our outcomes of our answer options, if we contact the physician, then we can let the physician know what's going on, get the patient treated, fixed, save a life, right? So, I'll leave A alone. Documents the findings, that's option B. If we document the findings, what does that do for the patient? What does that do for the wound evisceration? Nothing, right? So, it can't be B. Notifying the operating room. Well, this is definitely a surgical emergency. But if we notify the operating room, what is that going to do for the patient? Because remember, as a nurse, we don't schedule surgery. We don't coordinate with the operating room, the surgeons, the team, and say, I'm going to bring my patient in, they need an operation. So notifying the operating room doesn't do anything for the patient. We're not the one to schedule that. And D says, take the client's vital signs. So if we take their vital signs, we'll get blood pressure, temp, heart rate, respiratory rate, pain, all sorts of stuff, right? Great. But what does that do for the patient, right? What does it do for their wound evisceration? Nothing. So it can't be D. So our correct answer here is A. Now, this brings me to another really important point about when you have questions that give you answer options that might include contacting the physician or the healthcare provider or their practitioner or the whoever. What I want you to consider is that the NCLEX is your exam, you, the nurse, right? So it's not going to be too often that you'll come across questions where the answer is going to be just pass it to the physician or the healthcare provider or somebody else, because this test is for you. It wants to know what you, the nurse, do. What can you do? However, in cases where there is no option available to you that you can do, either because it's outside of your scope or it simply does not make sense to the problem or the scenario, meaning it's not going to do anything for the patient or the scenario, then we have to pass it along to the physician or the healthcare provider. So in this instance, contacts the physician is the correct answer. That's the only thing that we can do as the nurse. Nothing else on here is going to fix our patient's issue, either because it just doesn't make sense to the problem at hand or it's outside of our scope, like calling the operating room and deciding that we're going to bring in the patient. That's not how that works. So the correct answer here is A.